Welcome you all. My name is Dr. PJ Madam Rafi. Today we are going to discuss about hormones. So first of all, what is hormones? Hormone is a chemical substance which are synthesized by specific endogenous gland and secreted directly into the bloodstream. Okay, that means these are chemical substance that is synthesized by some glands, endogenous glands, and after the synthesis they are directly released into the circulation. So that is means in the bloodstream. Okay. So here, so there are some examples of hormones. So and they are secreting glands also. Hypothalamus, it will release thyrotropin releasing hormone, corticotropin releasing hormone, growth hormone releasing hormone. Along with this dopamine. While similarly pineal gland, it will secrete melatonin. If you are seeing thyroid and parathyroid, it will release. It will helpful in secreting T3, T4, calcitonin, and parathyroid hormone. Pituitary gland, it is a major gland. It has two parts, anterior part and posterior part. They will secrete growth hormone, thyroid stimulating hormone, adrenocorticotropical hormone, follicle stimulating hormone, luteinizing hormone, prolactin, like this. Samely, adrenal gland will secrete androgens, glucocorticoids, noradrenaline, adrenaline. Say, if you are coming to the stomach, gastrin, histamine, somatostatin, like that. If you see in kidneys, kidney will secrete renin, erythropoietin, like that. Then pancreas will helpful in secretion of insulin, glucagon, somatostatin. Samely, some important gland that is like ovary, it will helpful in secreting gonadotropin hormones like estrogen, progesterone, and prolactin will pull, and uterus is also helpful in releasing prolactin and other hormones. And if you are seeing in testis, it will helpful in producing androgens hormones like testosterone and estradiol and inhibin. So these are some examples of hormones produced by the different body glands, okay, into the circulation. So we will see in the following slides and in following classes each one in detail. Okay. So next is classification of hormones based on their mechanism of action. Okay. So based on the mechanism of action, hormones are classified into three types, that is nuclear receptors, cytosolic receptors, membrane receptors. Okay, if the hormone is acting on nuclear, they are classified into nuclear receptors. This is our MCQs. Whether they can ask which hormone acting to the which receptor, like that. So examples of nuclear receptor is T3, T4, estrogen, progesterone, testosterone. Okay, if you see all these are androgen receptors, androgens only. So these are all act through the nuclear receptors. Hormones mainly thyroid hormones and estrogen and progesterone and testosterone. So all these hormones, major hormones, they will act through the nuclear receptor. Samely, cytoplasmic receptors. Cytoplasmic receptors are examples for glucocorticoids, mineralocorticoids. Okay. Next group is membrane receptors. Membrane receptors we have two types, that is tyrosine kinase receptors, GPCR receptors, G protein coupled receptors. In tyrosine kinase receptors we will have example. This is an MCQ. Insulin belongs to tyrosine kinase. Okay. Mostly we will go with nuclear receptor. Insulin means, but insulin belongs to tyrosine kinase, that is membrane receptor. Okay. Next is growth hormone and prolactin. Next in GPCR group we will have fourth subgroup will be there, that is they will act through IP3 mechanism, that means releasing of calcium and helpful in releasing of hormones like vasopressin, oxytocin, gonadotropin releasing hormone, TRH hormone. Whether it may be to potassium channel opening, helpful for somatostatin releasing. Samely decreasing by cyclic AMP, dopamine will get released. By increasing cyclic AMP, rest of all hormones and B2 receptor, B2 hormone, that is vasopressin 2. Okay. So these are the MCQs. They can ask whether they act through which receptor. Mainly nuclear receptor and insulin. It is very important. Nuclear receptors are T3, T4, estrogen, progesterone and testosterone. Insulin receptor belongs to the tyrosine kinase. Okay. You have to remember these things very importantly because they are most commonly repeated things. Thank you.